All right, we are good to go.
Oh, that's Lawrence.
This is from.
Excellent.
That's
This is from.
Is this a, oh, okay. Is this a lobbying committee?
We probably want your hot water.
We're gonna get Iredell Center here.
All right, our last budget committee meeting to go through the details before we look at everything all together. Thank you, everyone, for coming. And it looks like we are set up to start with the health center budget.
Correct.
Great.
Correct. And Chris, you can take it away.
Okay. Pop into the hot seat where I can actually see most of you here. All right, so I'll go through and highlight some of the key points. Contracted salaries for personnel continue to be one of the major portions of our budget. We do have an increase in fiscal year 27 over fiscal year 26. Our fiscal year 27 request includes the cost of maintaining the status quo with our current providers, as well as creating a new position for a registered nurse in the front office. That has been approved by the Health Center Advisory Board at this point. That has been a position that has been identified as a need to support prior authorization, home care needs for patients, as well as returning some of our patient phone calls, doing chronic disease management in support of our provider team. It has been strongly requested by our provider team as a need to be able to continue to sustain our provider group. Lisa Health position will remain the same. Brandy's position will come with a small cost of living increase. In
Can I
our,
just ask one question about the first item?
sure.
Is the registered nurse gonna live on Islesboro?
It is not a required part of the job description. At this point, the one registered nurse that we know of on Islesboro has been approached about the position and has said that it would not be a fit for them. So it will likely be someone that we will be recruiting from the mainland. Whether they would choose to move to Islesboro or whether they would choose to commute by ferry would remain to be determined.
Just curious.
Do you have a breakdown of how many of the contracted salaries and providers there is, like, for each one of them? I don't even know half of our doctors anymore, I don't think.
Yeah, Janet, I know you have that.
And then what is the new salary for the nurse position?
The nurse position is $80,000.
You got four of your providers here. I think Kathy's the only one that's not here right now.
You had mentioned during the advisory meeting that you guys were hiring more per diem positions. Is that also included in the contracted salary positions?
Great question, Melissa. It is not included in the contracted salaries position, and the hopeful expansion of our pool of per diem providers is not going to come with a significant increase in per diem hours, but will just give us more individuals to be able to choose from to backfill vacations. Because most of the people who are working in our per diem positions have other full-time clinical jobs and don't always have the availability when we need coverage.
What line is that paid out of?
That is out of
Substitute
substitute coverage
1019.
1019.
Those are all your per diems?
Those are all of our per diems. Per diems, as well as any situations where any of us are working beyond the expectations of our contract to cover additional shifts that are uncovered.
Under the salaried contract or the contracted salaries, is there a cost of living raise for the providers in that? And what percentage is it?
Let's see, Janet, where is Janet? I know she calculated in a couple of cost of living raises for folks after the initial version that I had submitted, so I want her to
Do you know,
confirm.
do you know if it's around the 2.5% that the other municipal employees are making or higher?
It would be around the same.
I actually want to remind the select board that last year at this time, the providers actually took a pay cut to make the budget work. So the fact that they are getting a raise this year is, really overdue.
Thank you.
In terms of market rate in the region, Vinyl also recently had a position posted for $130,000 for the year for a full-time provider. So we're just looking at that from the standpoint of having 4 full-time providers on staff. You get some sense of how those calculations add up in terms of being competitive and being able to recruit in the local market. Janet, there was a question while you were out regarding whether you had calculated in any additional cost of living increase or raise for providers in your final version of the budget.
Did you?
I did not.
I did not. That was your opportunity.
So there's not a raise for the.
There is not a cost of living increase for current full-time providers in this. This is maintaining our same rates of compensation. Where there is a little bit of a shift from fiscal year 26 to fiscal year 27 is that we had additional providers added mid-year. My position converted from per diem to full-time in the middle of the prior fiscal year budget, which was not part of what was initially budgeted. And we have also brought on Kathy Philbrick full-time. She will remain full-time when Beth O'Mara drops to per diem at the beginning of the summer.
I just want to make sure, so this budget says 532. But the request here is 537, is that? I just want to make sure.
Did that have to do with your?
No, that was the adjustment that we made on Kathy
That 32 is-
Oh, it went from 110.
from 115 to
Mine
110.
says 532.
Yeah, it's also, that's different from.
132.
Hey, yours is different than mine. Interesting.
I don't think that we all have the same. Mine has draft 1/3/18/26 at the top of it. Handwritten.
Oh, yeah, my,
We should all have draft one, we've only had one.
I have 317 in my first day. I don't have anything.
Oh, yeah, my print date is actually
Oh, I-
36.
317.
But what do you have for number for 10-11 on FY 27 request?
532, 521.
I have 537.
Okay, yeah, so that is the updated one then.
537?
537, I believe, is the finalized one.
Most current version.
That one is printed as of 3/17. This one's as of 3/6. So I'm gonna say that one's the most recent one.
Can I get an updated copy?
You can have mine.
I can make copies.
Well, I'll make the
Here,
call.
wait.
I'll make a few.
So
copies.
537,
got a
it should
couple
be
extra copies.
537, is that correct?
Yeah, well, it's okay.
It looks like that's the only.
Well, that's-
difference in that line. Yeah, this-
Right in the trash.
Good for you.
Well, here's.
Perfect place.
It's just sitting there.
Thank you.
Do we need a few more copies? I can.
I've got
I
health services right there.
Okay.
It's all health service, that's what people are.
Yeah. Does anybody else need? Anybody else?
Yeah.
That looks like the only discrepancy in that section. 7 the total.
Cause I have to say. Whatever, I'm just gonna.
Yeah, I know exactly why it is. We dropped this down from 115 to 110. That accounts for that 5,000.
So I have 110 on here.
Yeah, so I think this number is right.
532,
532.
so,
but then we were just saying, you said 537.
well, 537 is what I have on
Actually,
my.
we have 537 as the
That's-
request here. I
that's
think
what's up
this
there
is
too.
not been updated.
Dear first was right.
Yeah.
First was right.
Oh. Okay.
I'm just gonna focus on verifying that.
Alright.
So we're going with 532 or 537?
532, 521.
Take this one back out.
I see. It was updated here.
Okay, sorry.
No, you're good, right? No, it's my fault, it's my fault.
So that was a good pickup. We've gone through a couple of versions of that in our review.
I don't see a date.
All right, then in terms of front office, 1015, there is a change from last year. We were paying multiple positions out of that budget line. That budget line is now going to be just what is being paid to Peggy Pike for her role. Her compensation stays the same from last year. Custodial services are staying the same. Substitute coverage, we had tried when we went to our 4-provider model to cut back on our costs for substitute coverage. And it looks like our 4-provider model did not cut those costs as much as we were anticipating that they were potentially going to. Looking at our current year-to-date projections, I think we are likely going to end up a little bit over budget in that budget line. So we have gone up on our request for substitute coverage to make sure that we stay in budget. I am hoping that we will finish the year and finish that budget line with some funds left over. I'm not anticipating a significant increase in the number of shifts that we're going to need to cover with per diems, but just to make our requests align with what we are actually utilizing. Line 41, we do have an increase to support the hire of a second medical assistant in the practice, which has been identified by our providers as well as our supervising physician as a current unmet need. We will have a little bit of an increase in employer contribution to FICA related to full-time positions, including both the full-time nurse position and full-time medical assistant position. Health insurance, we've had one individual who was paying for health insurance for family who is now just individual. Which has actually dropped down our costs for health insurance coverage a little bit and has actually absorbed some of the projected increases for new full-time positions. So we will be down just slightly for health insurance. And then for retirement, did you have an updated number, Brian, or were you still at the 20,000?
No, I don't have an updated number. The question that I raised earlier was, if with bringing on 4 new people who are going to be eligible for the retirement plan, is the $20,000 request, which is down from the previous year, is that really going to be sufficient to meet those needs? And the reason I brought it up, fiscal year 25 actual was 15,480 in retirement contributions. Bringing on 4 new people that are now eligible for that is probably going to increase it beyond that amount. So the issue that I brought up when we were talking earlier was that 20,000 may not be sufficient to meet those needs. No, I'm sorry, I didn't have time to come up with another number as a suggestion, but I think that's going to be low when all is said and done.
How does that work? Is that a match?
Correct. 5% match. So yeah, if all of the new people that are eligible for the retirement plan take it, I don't think this 20,000 figure is going to be sufficient.
Okay, so why is it that in 25, you budgeted 24,000 and it was only 15?
I mean, we budget for what we think we'll need.
Yeah.
And depending on who we bring on, so for example, if we're bringing in per diem coverage, they're not eligible for the retirement plan. And in 25, we had I think we doubled the budget numbers for per diem coverage. So we didn't end up using it because we're bringing in people that weren't eligible.
Thank you.
And not everybody might, take up to 5%.
Yeah.
And I think Chris has not signed on yet.
Yeah,
for us.
so it depends on as well what the individual wants to do. You know, if somebody doesn't want to participate in the plan, you know, they want to do their own investments or do it in another location or whatever the situation is, you know, they have that ability, but obviously they don't participate in the match then. So what I was thinking earlier when we were talking was last year's number of 25,000 is probably going to be closer, assuming all 4 people that are eligible or that will become eligible for the plan will use it. I was throwing out the number. I was just going with the previous year's number of 25,000 and thinking that's probably more accurate.
So there's gonna be 4 new hires total?
Well, the 4th one is Chris.
Okay.
There will be 3.
So Kathy Philbrick and I are 2 of those new hires who are already currently on board, and are included in our current provider contracted salaries. So the 2 new will be the registered nurse position and the medical assistant position.
And just to reiterate, Kathy is taking over my position, so it's a replacement, not an addition.
Right.
So last year, this time, budget time, we were budgeting for 4 providers. We're still budgeting for 4 providers.
Yes.
The new is a new RN and an additional
Medical assistant, correct.
She's actually a nurse practitioner, but she's filling an RN position right now while she's, oh, sorry.
So Kathy Philbrick is in a 6-month contract right now that is a little bit of a bridge position developing our new RN role. But as of the start of the new fiscal year, her contract will look similar to ours in that she won't be working full-time in a nurse practitioner capacity, and then we'll be hiring an RN to do this RN duty.
So, Brian, your recommendation is that we increase that 20 to 25 at this point?
Yeah, I believe so, yeah. Yep, good. I mean, we currently have, there are 2 people currently at the health center that are not eligible for the retirement plan. That will be changing, and the 2 new people will be.
Okay, other questions on retirement? All right, utilities, Central Maine Power, our number from last year was a complete ballpark guess for our new facility. Our new projections for the coming year are data driven based upon our utilization data. What we don't know, what is still the wild card in this, is that our ground array of solar is not up and in service yet. So we don't know what the impact is going to be once that goes online. That will likely bring this number down a little bit. Line 2011 is our answering service. They have increased their base cost to us over the past year. We are exploring some other options for answering services. I think that we're probably going to be able to, at some point mid-year, sign on a contract with a new answering service and help us to get those costs down a little bit. But assuming that we do need to continue with Big Messages, which is our current service, as well as our current phone service, we are at an estimated $6,500 for the coming year. Our projections for postage are going to stay the same. 2510 supplies, this is our office supply budget line, office supplies and custodial supplies. That budget line is expected to stay the same. Equipment repairs, sometimes we don't need to use this. It is critical for us to have a little bit of funding in reserve in case we need to have critical equipment like a defibrillator that breaks and is repaired. So we are budgeting $2,000 for that. Equipment purchases, we had zero budgeted last year because we had our CDS grant and we were making our equipment purchases out of the CDS grant. The CDS grant is now exhausted, so we do need to return to having the equipment purchase budget, which will be 4,000.
Do you have an idea of what equipment you're planning to purchase in the upcoming year?
At this point, it will not be any major new acquisitions. We are up to date with all of our emergency equipment. This would likely be things like disposable components of equipment if we needed new laryngoscope blades, new EKG electrodes or pads if we needed to purchase cables for equipment. Line 14, our service contracts include our electronic health record, Azalea, as well as independent practice services, IPF, which is our company that does our cost reporting and provider credentialing. We were at 60,000 last year. We have 60,000 budgeted for the current year as well. We're currently exploring other potential options for cost reporting, but are still very early in that process and do not have estimates just yet. I am not anticipating that we would take on a new cost reporting service that would require a significant increase in revenue. I would be, if anything, expecting that we would, if we took on a new cost reporting service, it would need to be someone that would save us some money in order for us to make that commitment.
Just a question, Azalea, I thought that we had over a course of number of years made investments in Azalea that I thought that it was going to go down kind of as we went through that transition. Is that I could be bad memory, or how does that?
That's what I thought too. No, I mean, there's no way it would go down. I mean, you buy these, it's increasing when you buy. First, we started out without the electronic health record.
We did. So it's a subscription-based service. We did drop a couple of optional packages off of our service plan with Azalea this year, that were things that we've found that we were not needing, and that was saving us about $600 a month by cutting those items out. But in terms of our basic costs for maintaining that electronic health record, maintaining access for our providers, that is a fairly fixed monthly subscription rate. Beth, I don't know if you have anything to add to that. I know you were part of the initial discussion with acquisition of Azalea.
Yeah, initially we had hoped to use their revenue cycle management is what they call it, where they assist with the billing and coding piece. And when you subscribe to that service, the electronic health record is included. We had quite a few conversations over the past year, one with the vice president of the company, and they did not want to take us on as clients because of our low volume. So we are left with the subscription that we have, and we do our own revenue cycle management.
Gotcha, okay, thank you.
The idea, I believe, that was originally proposed was, if we can increase our revenue to the point where Azalea does want to take us on, it would lower some of those costs, because by taking us on in revenue cycle management, we get something else that we're currently paying for.
It would still cost us a percentage of.
Yeah, it would still, there would still be costs involved, yeah. And we haven't yet kind of hit that level of revenue. It's still a credentialing fight that is still being fought, and it's something that's being worked through, which just takes time.
Yeah.
And I will say Azalea is comparable to other electronic health records as far as cost goes. It's an expensive system.
And it doesn't talk to Maine Health, does it?
It does not talk directly to Maine Health, and that has to do with interoperability with Epic, their system. and our system. There's potential for that in the future, and there's been, years of legislation that has helped push that. There's these intermediary depositories of health information now that, the two separate electronic health records can then communicate with in order to pull information. That is, also costly, and, we continue to explore those options, but try and go with the most cost-effective route, which at this point is to have a community access program through Maine Health, where we can access certain records of theirs rather than the entire all of the systems in Maine.
I know Penn Bay uses Maine Health. What about Waldo County?
Same.
Maine Health?
They
Yeah.
own each
So
other.
they
Right.
all operate off of a system as an enterprise level system called Epic that's utilized in all of the Maine Health hospitals across the state, including Maine Med and all of their satellite locations. MyChart is also a Epic program that is integrated within the Epic platform. Epic is extremely expensive. Maine General is looking at converting to Epic right now, and they have been quoted a price of $80 million for purchase of the Epic software.
Well, you're trying to look at
I had
Maine
$80
Health,
million
correct? And we have to have that special insurance.
So yes, we can get read-only access for us to be able to get copies of records that exist within the Epic system. That does not give us the ability to make entries in that record, or for them to be able to read our system, but it does give us the ability to be able to access test and imaging results and
And we're still
consultation.
trying to secure insurance before they'll let the health center do that.
Yes, there's been an update in Maine Health's insurance requirements that they now require that we be separately insured against cyber attacks, data breaches. So we are currently shopping for insurance to provide that coverage for us so that we can.
Is that listed in here also?
That would end up coming out of health center contingency funds.
We don't know
It's
what it costs.
not
I didn't
into.
know if we were building in anything in anticipation of it.
Well, it could come out of contingency.
It's not expected to be a high dollar item for us. It's not going to be on the same order of magnitude as things like our professional liability coverage.
That cyber hacking insurance, really all it does is pay for 3 years of credit monitoring and says, sorry, that's about it. I mean, there's not a lot to it, so it's not a terribly expensive product.
Yeah.
It's actually kind of useless, to be perfectly honest, but.
Line 2517, we're not making a budget request this year. We had $2,000 in there last year, actually the last 2 years that we have not used. Those expenses are coming out of other budget lines, and that's really become a redundant budget line. 2550 circulation materials, we had 500 budgeted for the previous year, 800 for the upcoming year. That is a periodic expense. The American Heart Association has updated all of their guidelines for CPR, advanced cardiac life support, pediatric advanced life support, which they do once every 5 years, and we need to purchase updated reference manuals and reference cards for our code cards, and for our reference materials in the health center. Mental health provider coverage, there is no change from last year. Medical supplies, this is our dressings, ointments.
Can I interrupt?
Yes, absolutely.
Sorry. I'm not familiar with the 25.65. Can you explain what that is? Because that's a big line item.
Absolutely. So that line item pays for the compensation and ferry services for our mental health providers, for Dr. Wright and for Emily Davis to provide mental health counseling services on the island. There is a portion of their services that we are now billing insurance for, that it does not cover the full cost of them traveling to the island and providing those services. So they each spend one full day each week in our clinic providing mental health counseling care for residents of the island.
Okay, is that from an outcome perspective, from a delivery perspective, is they're spending the time, are they, and I'm ignorant, I'm just trying to ask, is that service required every week? Could it be every other week? I mean, I don't have any insight in this, nor should I.
Yeah, the great question. So typically they are seeing patients every week. There are some patients that only have a need for every other week. Their services are being fully utilized. They are both on a wait list at this point.
So the wait list for patients to see them, is that what you're saying? I'm sorry.
Correct. Yes, they both
Okay.
have a wait list of patients waiting to see counseling.
Thank you.
Steve, I could speak a little bit to the history of that position.
If I can just remind everybody, the speaker's here.
Oh, okay.
And so I know it's hard to look at, you wanna look at
Right,
Steve,
right.
but I need you to look at the owl, that way he can hear you.
Steve, can you hear me okay?
I can, thank you.
This is Dory. This position was born from, sort of a spike in mental health needs, after COVID, during COVID. And the community fund, funded a position for these two providers for the first year. And then, and Beth knows as well, then over time, the town assumed, because it was so successful, it was really, really key to, the mental health of, age ranges from children to senior citizens, and continues to be. And both providers offer expert. They have decades of experience. Dr. Wright is a PhD and has a very impressive resume and deals with the more complicated mental health patients and can diagnose mental health conditions. And we work cooperatively to treat them. Emily Davis has worked with the school age population primarily, but also sees adults, and it's very valuable.
The other thing
Okay.
I would add, just from my memory, is we did have kind of an agreement with the community fund in that transfer, and I think actually this $50,000 represents, hopefully because it can now be charged to health insurance, is a reduction in what they had originally projected to be an annual cost. So that is helpful, and it's nice to see it being fully utilized.
Good. No, I appreciate that input. I just want to make sure that, it's being, the outcomes are related to the hours put in. It sounds like it is. So thank you.
And Chris and I recently spoke with Dr. Wright about this, if he felt, I did ask if he could consider coming every other week. But, he didn't think that would be
Clinically appropriate.
appropriate.
No, that's okay. Let's move on. I just wanted to check. Thank you.
Absolutely. Thank you for that clarifying question.
I'll move on quickly. I want to go the other direction. Is 50 realistic? Is that a realistic number for you? I'm just like historically, you had 31.2 in 25 and you spent 93.5. 26, we gave you 50 and you've already spent 40,400. Is 50, is that like enough? Or does it need, just because if we look at these paths, it looks like you're about to double what you asked for, so we might as well get.
Well, can
I was gonna say, let me actually clarify something real quick, because 2025 was the transitional period where the community fund was actually still paying us, at least for a portion of fiscal year 25. I think it stopped in the beginning. either in the beginning of 25 or something like that.
Yeah, we paid and then they.
It
stopped in February.
Stopped in February. Okay, so it didn't last all the way through fiscal year 2025. So this is the amount that we spent, but we did recover some of that from the community fund.
Yeah.
Going forward, the spending line is gonna kind of coincide with revenue, because again, we expect to start billing for these, or some of them we are already billing for. And we hope to be able to bill for more of them in the future.
I see what you're saying.
So yeah, the budget is kind of, or the budget line is kind of what we expect to end up spending net, after revenues are taken into consideration.
And donations go towards this line.
Yeah, no, I just wanna make sure, I'm very.
Excellent question.
For the program, I don't ever wanna see it go away, so I wanna make sure that we don't put it in any jeopardy.
It's an excellent question. Yeah, so previously we were getting money from community fund, now we're getting money from insurance billing, and that will continue to increase.
Yeah, and more, hopefully, where Dr. Wright has become accredited with.
Yes, he's now credentialed with, Medicare. I think he's also Medicare credentialed as well now.
And do we,
I could just feel the revenue coming in now.
Keep that up.
do we still offer any support to people who don't have insurance for this program? Yeah, okay, cool.
Because they have to pay, if you don't
Right,
have insurance.
that's what I
you don't
remember from
pay.
years past, so we didn't charge all of it with it for the insurance.
No, it's still the way.
I mean, it's not even a copay, they're not asked,
Yeah.
Glad to hear that.
so, yeah, I think it's a
Good.
amazing benefit.
Yeah, no,
Yeah, health center doesn't turn anyone away, but, well, right.
That's right, Brian.
I'm just thinking about the revenue, like if we're gonna, how we factor in the revenue of paying patients versus not paying versus. Excellent. Cool.
All right,
Okay.
please.
All right, 2570 medical supplies, but small increase from 26. That is not driven by any major increase in our supply needs, but by inflation and rising cost of materials. This is the line that covers all of our bandages, first aid tape, wound cleansing supplies, stethoscopes, day-to-day operational equipment. Pharmaceutical supplies include both the medications that we keep on hand for treatment of emergencies, as well as medications for dispensing from our pharmacy. Of note, the fiscal year 26 year-to-date number is not entirely accurate, because we had identified that this includes the purchase of all of the flu vaccines that we had purchased back in the fall, which is somewhere around the ballpark of about $8,000 or $9,000 that we spent on that actually will get reallocated under budget line 2574.
Yeah, we're fixing journal.
Yeah, so pharma supplies is at about 15,000 utilized this year.
And there is a portion of the vaccine expense that is returned at the end of the year in the cost.
Which is why it's important that we get it under the right line.
Correct.
Almost like you were reading our minds from our conversation a couple of hours ago. 2573 laboratory expenses. We have an increase this year that is related to an increase in the services that we're providing. We've greatly expanded our laboratory. We can now run complete blood counts in-house. We can do liver function, kidney function, cholesterol monitoring. And that does come with some additional costs for purchase of reagents to run those assays. Those are all billable laboratory services that we're able to bill insurance and collect revenue for.
Can I interrupt you?
Yeah, go ahead.
So one of the things I'd like for your group to start doing, and this is a great example, I realized a year ago, and again, I'm one of the newbies, but the more that we can provide services that traditionally forced a resident to go off island is pretty critical. And you group these in from a budget perspective, but from a I hate to use the word, it's marketing, but from a information standpoint, we ought to be tracking this stuff, making the community aware. So because some people might be going off for something that they don't have to. Um, and just start to, I think there needs to be better communication overall, because we want to reduce people's need to go off. I mean, we're looking at how do we subsidize individuals to get a ferry ticket to go to a medical where maybe you're doing it right here, and the community is actually saving money. So somehow in your thought process and in your thinking for the next few months, we ought to start creating a list of things that are, weren't provided, now they are, and here's what we're moving to. So something of that nature, I think, would be helpful for everyone.
I think that's a great idea. I completely agree.
And you already do that. But you're really.
Yes, we do have a new website that is now up and running and operational for the health center, which does talk a little bit about this. We also, we're now running a once a month primary prevention clinic focused on cholesterol management, where we're doing cholesterol labs, getting the results right then and there, making adjustments to medications as needed on the same day. We have caught a number of other medical conditions and preventative health concerns in doing that, including some issues with liver problems. We've gotten folks here on the island to stop smoking during those visits. And those are primary care, primary prevention visits that ordinarily might not otherwise be happening during the winter months. So that's also generating some additional revenue generating patient visits that insurance will pay for. As far as some of our laboratory services, we are also drawing labs here on site, so patients don't have to go over to the mainland for just about anything for their lab work. We have identified that for our complete blood counts and comprehensive metabolic panels and lipids, it is less expensive to run those labs through our in-house assays, less out-of-pocket costs for patients typically than it is for those to be sent over to the mainland.
So just to put a fine point on this, there are just way too many places for everybody to go for information. So, we get something in the, in our mailbox once a month. I would suggest consolidating the communication. It could be quarterly or whatever, but not a big deal. But just put it where everybody gets something, and it's up to them then. Because I frankly haven't been out to your website. I go to the town website, but you know what I'm saying. So just something to think about.
Yeah, absolutely. And I would be more than glad as well to continue this conversation with you moving forward and work with you to develop something that'll be a really good strategy for communicating the work that we do to the community. I agree with you. I think we get sometimes overly inundated with information, and if we can make things concise on a little bit less frequent intervals but high yield, I think that's a great strategy.
And to Steve's point, I had no idea that you guys were doing your cholesterol panels. I had no idea that you had a website. I have no idea about anything. If anybody here did, feel free to tell me that I'm wrong. But you've got a board that meets twice a week across the parking lot from you, and no idea.
Yeah.
Well, twice a month.
That's what I meant.
I know.
Lately?
Lately, yes.
Lately I have been. And
so what I will put on my to-do list on the short term is that I will email out the link to our new health center website to all of you tonight. The old Islesboro Health Center website that was a part of the town website is also now set up with a link that takes you to our new website for the health center.
Yeah.
The last time that I done that, it was an error 404.
I'll bet it was while it was in the middle of being updated and switched over.
Yeah, I'd like to talk to you about this further offline because, I think it's a simple fix. So let's move on.
That would be great. It sounds like a great opportunity for collaboration.
So just sort of generically, how do you consider the feasibility, economics, revenue for other kinds of regular services that people generally go off island to get, like dermatology or dentistry or ophthalmology, you name it.
Great question. Dermatology is a great one to speak to, actually. We recently purchased a dermatoscope for the practice. I went out in December to Mayo Clinic training on using that scope. We're starting to use that to do more involved dermatologic exams. And I'm actually doing a lot of skin biopsies in the practice right now. We're finding that that is facilitating triaging patients to available dermatology appointments, which are a little bit difficult to come by. And we're finding that we are able to get patients in much more quickly if we can already go to that dermatologist and have a biopsy proven diagnosis. Dentistry and ophthalmology remain a little bit more challenging at this point because those services are not included under the generalist licenses of our staff. So they would require recruitment of a dentist or an ophthalmologist to the island. We do have Dr. O from Caring Hands Dental, who does run periodic dental clinics over at the community center.
I tried to sign up for that, but I never get anybody on the phone or.
Those are gonna be moved to the health center now, right, with the added space and everything? It was part of the,
If Dr. O would like to, yes, the space is there and available, we can collaborate with him.
Okay.
It doesn't, he does have a band.
yeah,
So it really,
usually they take up the entire community hall when
Yeah.
they set up and do it. And so I know that that was one of the big pushes for, during the build of it, was that there would be mental health rooms, the specialist rooms and availabilities and stuff like that, because some people weren't comfortable going to the community center and being, you know, so exposed to do your dental work. And so it'll be nice when he's here now.
So it's, again, it's up to, him, like the space is available, but it'll be up to Dr. O and his patients. He handles his staff handles the scheduling of the dental clinic. And they are quite busy, which is why you may call and leave a message and not get a call back. I will say that they're really great at triaging. They've called me before the morning of a dental clinic and said, one of our volunteers is not able to make it. We need to cut the schedule. Please help me find out who needs this most. And they'll prioritize children and prioritize those who do not have insurance. So, yeah, so I can't make a promise other than that the space has been made for specialists and we do network. There's a hand specialist who really wants to come out here and do some follow-up clinics you know, it's wonderful that we're able to offer the space.
Yeah, I am also very open to discussion if there are additional clinical services that there's a lot of interest in having at the health center. We have a pretty broad scope of practice, and that may be just a matter of getting some of our personnel out to conferences and courses to get them trained and getting equipment. So if there's interest in specific things that are within our scope, that is certainly something I would love to have a conversation about.
Well, I don't have any authority here other than one vote, but I think you're doing a fabulous job.
Thank you. That it means so much to hear. I do very much appreciate
My
the support.
background in interface with medical services was all in Manhattan, which was just a nightmare. And this is so wonderful and accessible, and people are just wonderful. And I can't tell you how I'm bragging to all my friends elsewhere.
Well,
Don't bring him here.
All right.
All right. I think we are on to our next page.
3010, drop training.
Travel and training, we do have an increase this year that has to do with the number of positions that are requiring specialty certifications that need to be maintained. So Brandy now holds the Certified Rural Health Clinic Professional Certification, which does have costs associated with maintaining that certification, including a requirement to travel in person to one of their conferences. I am also pursuing that certification. That certification covers knowledge of all of the regulatory base of operating a rural health center, managing reimbursement, managing personnel, and keeping the facility legally compliant in our operations. This also includes the costs of maintaining certification for the medical billing and coding specialists course that Brandy is currently completing, which will allow us to help optimize our revenue and keep some of those services in-house. And then all of our annual continuing medical education, advanced cardiac life support, pediatric advanced life support, advanced trauma life support courses that are required under our contracts.
Are they doing any of them still online?
The ACLS, PALS, and basic life support are no longer being done online. That was phased out by American Heart Association in, I believe, October of 2024. Some of that training we are doing in-house. I am an instructor for some of those disciplines, and it is a cost savings to us when we're able to run the courses in-house. Advanced trauma life support and difficult airway courses are the ones that remain challenging. Those require, so advanced trauma life support as an example, the course director for that course has to be a board certified trauma surgeon. Which limits some of the places that we can go for that. We had a period of about 3 years that there were no ATLS courses in Northern New England. So we were looking at travel to New York and Pennsylvania. There's some courses starting to pop up in Northern New England again. Dory and I both went through a course down at MeMed this past fall. It's a certification that is every 5 years versus ACLS, PALS, and BLS, which are every 2. So that does spread out that cost a little bit. But certainly the portion that we've been able to run in-house is a cost savings. And Islesboro Health Center is a accredited training site for American Heart Association.
Good. Let me just, is there any, in my business, you know, we send a lot of people to training and we pay for that wholeheartedly because it's benefits everyone. However, we expect them to stay for a year past that training period in order to, you know, for the town to be able, or our business to be able to benefit from that. Is there any attachment to someone who's doing additional training that, I know there isn't, but maybe it's something to think about, that you know, that if we're paying for training, we're not training someone when they leave 3 months later and they take that new certification to another area. It's a, you know, we're paying for the training. We want to at least have at least a year, I would think. So just something to think about.
Yeah, I think that's a great consideration, and it is written into our contracts. There is a fixed amount that we get for training for continuing medical education on an annual basis. That is really the cost of maintenance of certification. Above and beyond that, I think if we were sending someone for a specialist certification that was above and beyond the usual costs of their training budget, I think it would be entirely appropriate to put that sort of stipulation on the position.
Yeah, and that could be, I just look at a doubling of that cost this year, and I'm going, all right, there may be that type of training that you're talking about. So let's move on. I just would like to make sure that the town benefits from that education. Go ahead.
I'd like to reiterate what Steve says. I think that's a great idea. Do we have that for any of the other town employees, for all municipality employees, that if we are spending $2,000 to send you to go get a certification, then you now have to provide a commitment to stay with the town for 2 years, or you will pay back a percentage of the amount that we just paid for?
I want to interject really quick. Most of this is continuing education for certifications that they already hold. These are not new things that they're being taught. They have to go to these classes to maintain these certifications.
Right.
So,
but we don't want to maintain it for him to jump ship and go to Penn Bay. or for Brandy to leave and go to Vinyl Haven or anything like that.
But
they
have to maintain it every year
Yeah,
anyways.
yeah.
But why, so then, and I don't wanna drag this, but if it's been around 10 grand for the last couple of years since 21, maybe you explain this and I didn't hear, but just tell me why there's a 50% increase then?
Oh, sure, absolutely. So we now have, so in addition to the certifications that we have been previously maintaining, we now have additional roles in our practice that require certification. So our billing and coding requires a certification and requires maintenance. And we were not paying for a certified biller and coder in the past. That was limiting some of our ability to be able to recover revenue. It's going to be able to help us to optimize our revenue, but that certification has to be maintained. And until recently, we have not actually had, not always had someone who holds the Certified Rural Health Clinic Professional certification on our staff. So we now have 2 personnel who hold that certification who are required to maintain it.
Okay,
So
thank you. Go ahead, anybody else?
it's just for the billing and coding and the rural health.
Billing and coding and 2 people for rural health.
Yeah, 2 additional people. Kathy coming on is one of the new people.
So Kathy does not have any of these additional certifications. She will have, of course, all of the maintenance of certification. So our 2 certified rural health clinic professionals who will need to maintain certification are Brandy and me. And then Brandy will hold the billing and coding. The requirement for attendance at the annual conference for the Rural Health Clinic Professional certification, which is a big part of this because attendance is required in person and requires travel. That is an every 2-year expense. That is not an annual expense. So this includes a year where attendance at that conference is in our cycle.
Okay, that's good to know. Thank you.
Great. And Melissa, what were you saying about town employees? I think the only training that we have that Tina or Dave would go to would be elections or motor vehicle.
I was thinking more public works, like forklift certification or CDLs or anything like that, especially with us looking into the plowing contracts.
Yeah.
There's a lot of other aspects of it, or like if we send Melissa Olson for something for the library, is just making sure.
But we already send Melissa Olson for things with the library. I mean, it's just part of doing her job. I go to classes in Augusta. It's just part of doing my job. These aren't necessarily new skills that I'm learning that I can take somewhere. I mean, these are just, nope. These are just certifications that, need to be maintained.
Right.
In order to do the job. So I mean,
It's probably from me and Steve being in different positions in former lives. At the sheriff's office is where I'm using my thought process from.
Yeah.
It didn't matter if you went to a conference that cost $300, you signed the piece of paper that said, we're sending you to the conference, you're learning skills. 1, you will bring back the skills that you've learned and you will improve what you're doing. And 2, if you leave within a certain period of time, based upon the percentage of, like, if it was $300, I had to stay for a year, otherwise I had to pay back the $300. If I left within like 6 months, I was required for paying for any training, even if it was a required certification, like the talk licensing and dispatch certifications.
At a certain point, that becomes vindictive and you're no longer actually investing in your employees. You're holding a noose around their necks.
Ambulance Association does that with
Yeah.
training that we send away people, especially the paramedic. If they were doing that, they have to sign
No, because I'm living in Maine. Thank you.
so the Ambulance Association does that
Right.
training. They want them to stay.
Right.
So they
Exactly.
sign up, or else they're supposed to pay, obviously, a portion.
Okay, so there is parts of
Yeah.
the town that does it.
Anyway,
I
we're
would
within
just-
minutes, so
I
I
would
guess we
like to
need to keep cooking.
I do think the previous budget, really the last few years, we have not been able to do all of our trainings because of staffing and the demands of building a new health center. So we really we've kept up our essential credentialing. But as far as continuing education for primary care, that has been challenging because we need to get substitute coverage to cover those days that we're out. So, I think the previous numbers are artificially low.
Great. Right, just in the interest of time, let's keep going.
Perfect. I think we've got a lot of the heavy duty stuff behind us, actually. Sharps collection, I'm not expecting significant changes in our expenditures. 4010 dues, this includes both dues to professional societies. It includes our membership in the National Association of Rural Health Clinics. We previously did not have our membership in National Association of Rural Health Clinics captured in this budget line, so that is brought in now. Historically, that's been a budget line that I think we have all underutilized a little bit. We do all have a certain amount, I believe it's 300, is that right, Janet, in our contract individually for memberships in professional societies? So this includes the amount that is included in the contracts to each provider, as well as that National Association of Rural Health Clinics membership. Line 4011, consultants for data matrix, we're no longer utilizing them as a consultant. Malpractice and liability insurance, 40-52. We've had a small increase from 32,000 up to 36,000. That is just related to an increase in the actual cost of coverage. There has not been any significant increase in our risk assessment or anything where we're being assessed at a higher rate. It is just an increase in cost. Then our supervising physician, Dr. Prast, was contracted at 25,000 last year. He is anticipated to remain at that same rate. We have decreased from previously having 2 supervising physicians on staff to just having 1 on staff now. We are getting a much greater value with Dr. Prast than we have in the past. He is physically coming out to the island 1 day per month. He has been very actively engaging in our operations, interfacing with us regularly, doing very active chart review, participating in policy review and development, and really functioning as an active part of our leadership team.
Dr. Press did send a letter to the select board as well. I think
Yeah, I
it was
got it.
passed out earlier. Yep.
And then last but not least, our contingency funds, 20,000 last year and asking 20,000 again this year, really just covering any unanticipated expenditures, or categories where we may need to reach into some emergency funds.
Okay. And then revenue, we don't have on this line, we don't have the comparison. How does the anticipated revenue relate to last year's budget?
The revenue expectation is the same.
Okay.
Yeah, pre-budgeted, which we'll get to when we get to revenue, but it's, and right now, this was back in. I'm trying to ram this with my tip, ram it right over back. We've taken in, $142,364, and that was probably 3 or 4 months ago.
Did we get clarification on whether or not that number includes the cost report settlement?
Did we receive, that was gonna be around 14,000? Is that right? I'm thinking.
You're asking, does the revenue figure include what we got back from the cost report?
Yes.
I'll have to go look. I have no idea off the top of my head.
It should, I mean, it should, we received it, I mean, we were watching for it.
So
Yeah.
it generally goes into that, I guess my question.
It should, yeah.
It goes into that budget line.
Yeah.
Year after year. Okay.
Yeah, I mean, that is where it goes. I'll have to, I don't know off the top of my head. I'll have to look and see if it's in there right now.
Well, they don't share. I wanted to make sure it wasn't a separate line.
No, that was not.
No, cause, no.
Any other questions for Chris or the health center crew?
With bringing on the new nurse and the, medical assistant. Am I right in saying that daily you will have a medical assistant, nurse, and either a PA, a doctor, and then on certain days you'll have lab techs and specialists that are also in the building? Or am I missing somebody?
So on any given day, we will have, during regular work days, 2 providers, either PA or NP, 2 medical assistants. We will have our billing specialist, and then our phlebotomist.
No doctor. I mean, you're talking about specialists that may come?
And then one nurse?
And 1 nurse, yes.
Okay, so, yeah, that, I wasn't sure if I was including Frost and like the other ones that come through, just vaguely, so.
Does he see pensions?
No.
No, he doesn't see pensions.
Oh, okay.
I don't have him on.
Good, then we don't have to get him credentialed.
Right. Okay, so 2 providers,
We don't have to get
2
credit.
medical assistants and 1 nurse, your billing and your lab.
Yes.
Any other questions? Great.
Sorry, I hate to throw one at you, and I want a 60-second or less answer on it. So you gave us the budget. What else do you guys really need to do even more within 60 seconds, if there's anything?
I have really made those requests in our budget. Our most urgent needs are the 2nd medical assistant and the nurse position. And really being able to optimize our training and make sure that we're all getting the trainings that we need to be able to maintain our certifications.
Great. So training is high on the list.
Training and additional clinical personnel support are top of the list.
Okay, like that.
Dean, feel free to chime in.
Say something.
I think consideration in years to come, the year to come and following years, is the 24-hour day demand for emergency calls. The clinic has just gotten increasingly busy. Last summer, part of that was because we just moved and, we were still getting settled and putting away equipment and just getting workflows. But it's a big ask, and it's becoming bigger to be on call and to be up during the night and then having to go, this time we finally, I'm not gonna say it, but it's, we've had time to catch up on things, but it has just been nonstop, the summer into the fall. And as everybody knows, there's been just a rash of loss. And I think we see that really in stress with the EMS crew, fire, boardman staff, and really across the island. Our population just is aging and aging. And so consideration of how to address that 24-hour call, not that we shouldn't be on call, but should we try to look at how to support EMS so maybe the providers don't have to go out on every call. And this is an ongoing discussion on Vinyl Haven and North Haven and has been for decades. And so
That's why I asked the question. I'm holistic. So let me I didn't want to delay this, but that brought up a great point that I think as we move forward, a holistic approach to how do we manage that requirement sounds important along with. So I appreciate that. Thank you.
On average in the winter, how often are you guys receiving nightly phone calls? Like every time that you're on call, you get a request?
It's really variable. Last week I did on call. I maybe only responded to 3 phone calls, like 3 or 4 after-hour visits.
And you're on calls over a week at a time?
Yeah.
Okay, just making sure that I've got
Well,
that.
actually, I'm
You're
we've been
funky, 'cause you're
staggering.
right.
I'm funky. I did, that was a 5-day stretch. The previous stretch, I had, ambulance calls, that I needed to transport people 3 out of 4 days, and then after-hour visits, almost every day.
Okay.
So it's really, it's the unpredictability
Mhm.
that makes it, a big ask, because we're also maintaining primary care, throughout the days, and we have our primary care panel, basically the patients that connect with us and we connect with and that we're following up with. And it becomes, difficult to manage those competing demands in very different scopes, on a long stretch with limited sleep. And I mean, honestly, that's why I'm making the decision I'm making, because it doesn't fit like
Right.
that way.
And Melissa, I know you were a part of the debrief from one of our recent cardiac arrests as well. For us, when we do one of those cardiac arrest calls at 3 o'clock in the morning, we may, with 5 hours to process that, be going into 4 annual physical clinic visits and half a dozen tick bites in the next day.
Right.
And we also function as the urgent care, which in the summer, the community has come to trust us and know that they can walk in, and it's really, we're trying our best to be respectful, but also to set some boundaries, because it's
So.
It sounds
during-
like the Quicksilver captain issue years ago. So that, the unpredictability, you're just on call. It's just, that's not something that an individual can sustain. So that's really good information. I'm glad I asked the question. Thank you.
No, it is, and it speaks a lot because that's exactly what we're asking our ambulance staff to do.
Yeah.
Our entire EMS staff is doing the exact same thing, and they don't respond to tick bites. Everything that they respond to is a little bit higher urgency to at least the person that is calling.
of course it is.
And so,
But their time on duty is not as long, is it? I mean, when I was on, it was a week on, week off. I don't think.
no, they get to pick their times right now. And so, but with more people dropping off of it, I know that the medical assistant has left the ambulance service. There's no requirements for anybody from the health center to be part of the ambulance service, which is neither here nor there, but.
Well, there's requirements for the providers.
Right, but for the MAs, the nurse, any of that, it's their discretion for it, which is helpful. You had said during the health advisory board that during the winter, you guys average 10 calls a day. You see approximately 10 patients a day, whether scheduled or walk-ins.
I would say that's about right on average, yes.
Okay. That's all the questions.
Sorry, I'm gonna just go on because, but you have to realize also that we are the pharmacist, and up until, we are the nurse. Odessa also does the laundry, often cleans, stocks the rooms, so we are all working to like our fullest capacity, and I think that hiring a medical assistant, if you look at a typical office practice on the mainland, one provider has at least 3 support people. Each provider. So, to be able to develop that role is gonna help us see more patients efficiently and provide better care.
Got it. That's great information. Thank you.
Thank you.
And since, all of you are here, and you grew up, there has been so much loss in this community, and thank you. I know the EMS, it hits them, and all 4 of you who get to know community members on a really personal basis, and I know it has got to be really hard, so thank you for all that you do.
Yes.
All of the time.
We feel it, we feel appreciated and,
Yeah.
share the loss.
Thanks to this board and the town for all the support. It's a lot, and especially, for all you know, for this, but mental health especially is a really big deal, and I appreciate you pointing that out, Pete. That is something that has made a huge difference in the ongoing support, and hopefully, you know, I think we all feel that way, but I did want to say that.
And thank you for all of your support, keeping this whole ship afloat.
A big ship now.
All right, if there's no other questions, thank you, Chris, thank you, Dory, thank you, Beth, thank you all.
Now we get to sing.
It's not required.
I think it is held at the main community.
Where did you all do this?
Thank you.
Janet,
Yeah.
Oh,
I think we get a
I had to
monthly,
make this-
we get a quarterly invested fund statements, and it's listed.
That's right, he's got one of this.
Bar Harbor. Oh, it's not it.
Christine, I wanted to say thank you for your comment.
Um,
I appreciate that.
I know there's a lot of online mental health that's cropped up, especially since COVID, but it exists.
I know, I wanted to say something about health insurance.
Janet,
Do you know?
Janet was out,
Yeah.
that was-
How much is in
Gotcha.
charitable endowment?
That's right, yeah.
That there was a.
I'll go tell her that.
I don't.
Yeah, I don't.
Oh, Chris, I do need to ask you, you said that. the
Hey,
letter
Shay,
that- Yeah, yes.
But I can't go with.
are we
Chris,
still
you
in
said the-
session? Are we gonna do the
Oh, yeah.
Yes, I'm trying to ask something, hold on.
broadband?
Yeah, but it just,
We're getting
we are, it is a fair
Okay.
question, because we are still in session and we kind of broke up, so
Yeah.
let's just.
No, absolutely. You had mentioned that the town attorney that we hired for Privity Flaherty does not handle rural health, and that you needed an attorney that handled rural health centers. I'm not seeing that in here.
So at this point, I've had, Janet has reached out to our existing attorney to see whether or not she has contacts that can support those needs for us. I don't anticipate that that would be a consistent retainer, but times that we might need an occasional consultation that could be managed within our contingency budget.
You mean you were only to ask me about the. But the lawyer?
Yeah.
Okay, that's what made me think of that. So you can ask Chris what was said during the advisory.
Gotcha, okay, thank you.
Thank you.
All right, we are going to keep going on the
Thank you.
budget. Up next, we have capital reserve.
All right.
Sorry about that, Steve.
Is it gone?
No.
No, I'm,
Are you trying to go somewhere?
No, we're
well,
trying to.
no, I am gonna go somewhere, but I just
No.
wanted to make sure I was still on track with you guys, so it's hard to hear sometimes, so.
We lost everybody but Mert, so.
You stammer.
There it is. All right, capital reserves, starting off with 7010, Dark Harbor wastewater treatment facility. We ask for money there every year because at some point that thing is gonna fail and we're gonna need to throw a lot of money at it. So we're asking for another 30,000 this year. Going down to municipal building, that's 7028. Currently nothing in that fund. We're asking for 20,000. Was that for public safety? Is that renovation?
Public safety, right?
Yeah.
All right. So yeah, asking for an additional 20,000 for renovating the public safety space. 7051, that's the solar on the salt building. It needs a new inverter. if I
Not
remember.
at this time,
No?
but the gentleman said to me, they're very expensive, so we should start putting away.
Okay,
And if that one might need it at some point, these
And
might need it.
that's one of those things, when it fails, it's done, like we need to replace it immediately because it's no longer providing power, so.
Would 10,000 cover that? I assume it would, but like, we know what the cost to replace it would be. I'm just wondering, like, as a possible, like, penny pinching moment. If we know that it's only gonna cost 9,000, could we just put 9?
I think it'd be more than that.
Yeah, I have no idea, so I have no idea what solar systems cost.
Well, and this would be this wouldn't be like a hobby solar system either. I mean, it's
Yeah, no, I just,
throwing around quite a bit of power, so we would
Right.
need a sizable inverter.
yeah, I just wanna make, yeah,
But yeah, no,
you know, like, if it's only 8,000,
Oh,
we put 8 in.
I don't know.
It would be between 10 to 40,000.
Okay, excellent, thank you, so we should.
That's a
Oh,
big
no,
range.
sorry, that's renovation, not solar. Oh, sorry, he didn't give me an exact price, he just said we should start putting away.
Oh.
So if you wanna knock it down?
No, I didn't, I mean, I'm just wondering if that would be a moment.
So there's
Just
4,700 in that fund currently. We're asking for an additional 10. Going
That
down,
47, excuse me, that 4,700 that's in there currently is what's left over from we paid off.
yes,
And I'm using that money to pay for
the main,
maintenance, annual maintenance on the solar panels.
yeah, so the 4745 is already earmarked.
We'll pretend like it's not there.
Yeah,
Uh,
well, it's a couple of years that hopefully.
Going down to 70-11, asking again to put away another $5,000 for a new fire engine.
Yes, sir.
Yeah. And 70-12, asking for 20 for new ambulance. The ambulance is a bit older than the most recent fire engine we have, so that one's probably gonna need to be replaced first. 70-36, emergency ferry trips. You know, of course, ferries got more expensive. We're asking to put more away.
And again, I will be using some of that balance that's in there to replenish the overdrawn account in the expense line of ferry fares. Emergency ferry.
Going down to 70-15, road reconstruction. Asking for another 250,000. Are we doing paving next
I
fiscal
hope
year?
to.
We hope
I
to,
hope to.
okay, we hope to do paving.
And can you remind me, we also budgeted for some paving in the operating budget as
Correct.
well?
Yes.
And
So is that
this
gonna cover
it won't cover your stuff yet.
the, always a bridesmaid?
Yeah. Did you get the announce of what you thought it would be yet?
I'm still waiting for that.
I don't dare.
And we have a placeholder, in 50 grand.
15 or 50?
50, I know.
All right, going down to 70-20, landscaping equipment, we're asking to put 10,000 in there. I think we just took out the remainder that was in there for some new string trimmers for public works, so we need to replenish that some. And I don't remember if it was, I don't remember if it was Peter, or if it was Steve that asked about this, but 70-42 is where the excavator is, so we're asking for 70,000 there.
So is the excavator, is that the device that can cut back the tree line?
Yes. Yes.
Amongst
yes,
other things, yes.
Yes.
But is that a 70 grand 1 year? I mean, isn't that a capital expenditure that we can spread, or what? How do you do that?
Well, we could, if we wanted to save for it for, say, the next 5 years or something like
no.
that.
So
But I
when
mean,
you
it-
say, if we
Yeah.
pay, if it's 70,000, we have to budget, even if we put it on a payment plan? I mean, I'm just asking, I'm just being ignorant here.
No, I mean, we haven't gone through any payment, you know.
Yeah, no, we haven't looked into any sort of payment plans.
Okay.
Usually that involves interest and financing, and then it
Right.
ends up costing more. So, I mean, if we can just get the thing outright, that would be
Okay.
preferable. Was this the cost, do you remember, was this the cost of a used one, or was
No,
this,
it's new.
this is a new one, okay?
And how much a machine is it? Seems that expensive.
No.
Maybe estimate.
35, but something, something around like what's out.
But you get a discount for being a.
It's being new.
Yeah, you
You're
get,
your 40.
Okay.
well, I'll find, I've got that folder. at the
No, that's
bottom.
fine. I just can,
And that,
But it will do what we want it to do. I mean, that
Right.
was a majority.
it will. So
Something
when we
take
say we need to do a road cutback, the answer we hear, because we're budgeting for another public works person and we're budgeting for a machine, is that is work that can be done at,
That's work that we currently have to contract out.
right?
And I mean, we spent quite a bit to shore up, I believe, 1 mile of road last year.
No.
Right, no, I just wanna make sure that this investment is actually going to see real progress next over the coming.
Yeah, because
fiscal
it has that mulcher head on it, has that, this excavator has that special.
Okay, yep, Bob, go ahead.
He's on mute. You're on mute, Bob.
Bob, we still can't hear you.
Right.
Thank
I'd like
you.
to go back, I'd like to go back 2 steps to road reconstruction. Very quickly, does that budget include lining the roads in any way?
So, lining is in striping?
As in striping, yes.
No, it's a separate line in the public works.
Janet just walked out of the room as our road commissioner, but she says that is a separate line under public works. Janet, it would be helpful when you get back.
37-13.
Yeah.
45-1-37-13. Page of public, page 9 of 18. It's under section 45.
Striping, 20,000.
Bob, there's 20,000 requested for striping right now.
Wonderful. Thank you so much.
So 37-13. Yep, that's the one right there.
Which I usually do after the paving, so.
Right.
If this.
Well, that would help.
You know, the whole time there was.
All right, thanks, Bob.
Yep.
Can we
Thank
put
you.
in a few passing zones on that? Never mind.
All right.
Things.
Going on to 70-50. Oh, unless anyone had any other questions on the excavator.
Just a thought, just because would it be something that could be utilized at all to assist in the plowing contract where we referenced needing a front loader to be loading dump trucks with sand? Would that piece of equipment possibly be usable for that? I'm just thinking ways to make that contract a little bit more.
It's got a bucket arm. I mean, in theory, it could be used to.
Is it, okay, I wasn't sure if maybe it would have a
It
front
will-
loader too as
It will
well.
come with a bucket arm too, in addition to the chipper.
Believe so.
Yeah, I just wanna make sure
Bucket.
that we're buying for, we're paying for both. It's-
18-inch bucket, quick attach coupler.
And I mean, an 18-inch bucket is not that big.
No, I was talking to someone about this exact idea, and I told them, it doesn't make sense to sit there with your excavator and go 75 scoops deep to
Yeah.
fill this thing.
Yeah.
And, yeah, it's not much, that's pretty small.
As the escalator.
Mongo.
It could potentially be used for ditching though, which we also, which we also contract out, so.
It could do what?
Desperately.
Ditching.
Used for ditching,
Oh, yeah, baby ditching.
baby ditching.
Which is different from skitching.
D with a D.
Skitching, remember that? That was like a 50s term. Anyway, go ahead.
All right.
Only in Back to the Future.
Okay, let's stay on topic here.
Alright,
Okay.
70-50, Sea Level Rise Engineering, we're still putting money away in that every year, like we have been, asking for another 30,000 there. Going down to 70-21, building and system aging, we emptied that out recently when we had to do an emergency septic system for the town office.
I guess they C-section.
No,
I'll be,
different procedure. So we're asking for 50,000 to replenish that fund. Any questions on capital reserves?
yep, real fast.
Yep.
Is this the time to request something in this?
Request whatever you want.
Okay, just thinking, Janet, about our library conversation earlier and the repairs to that and the cat breads. I'm just wondering if maybe we could, I don't know what those are gonna cost. And there's nothing added in, and I don't know if we can do a foundation repair.
I've already got money
Oh,
set
okay.
aside for that,
Okay.
60,000.
Oh, all right.
We had budgeted a couple years ago.
All right, cool. All right, well then.
Yeah, for the foundation, and when
Right.
this company comes out, it may not be, it's expensive, but James Nelson.
Okay, cool. Yeah, I just wanted to make sure, because when I heard foundation, and then on that, I was like,
That amount is not,
Yeah.
no, that's a holdover from the previous year. We budgeted
And
for,
so-
it, didn't end up spending it yet.
I'm just doing my
No.
liaison duty.
I ride by and see it every day.
I don't know if I'm sure.
So if you have $60,000, where is that in the budget?
It's not in the budget, it's in, general ledger.
Yeah, it's a holdover from a previous year. We budgeted for it, we never spent it, so it's just being held over from the previous year.
How many-
It's basically an undesignated fund balance. We just know it's there.
How many of those do we have?
Yeah.
How many what?
How many undesignated fund groupings do we have?
There is one. It is
Library.
the undesignated fund balance.
How many earmarks are inside that balance?
Most of them are already reflected in the budget numbers. For example, when we were going through law enforcement, and it was there was 28,000 in one of those lines, and we're asking for 14. That's because we carried 14 over from the previous year. Usually, it's reflected in the budget numbers. Not always.
Yeah, I mean, we don't put that in against expenses. So this is something that the auditor has carried for us, so.
Yeah.
I mean,
No, it's
let's
just
get
helpful,
her-
like, I think for transparency's sake, it's helpful to have it, accounted for
I mean,
in a meeting so that we all have a good sense of what is there and.
Ideally, we would have spent it in fiscal year 24 when we raised it. It just,
Right.
that didn't happen. So, we're still holding that money. It just, you bring in somebody to actually do the work.
Yeah.
Yeah, it's like we're holding money that Earl McKenzie collected for the harbor,
Yeah.
Big Tree Beach
Oh, yeah.
business. That they've all agreed now to put towards the new pier. That's that
Yeah.
50 some odd $1,000 that they're.
Yeah, so is there a report that we could have just in our budget document so that we could see what those look like? Cause I think that is, it sounds like it's a number of things that come into real money.
I mean, it's just it's a limitation of fiscal years, basically. I mean, it would be the same if it was a calendar year. It would just be a limitation of it didn't get done in this year, so it carries over. But yeah, it just becomes part of undesignated fund balance.
Yeah, it's just those two that the auditor, we can find the permission that the auditor says that she's carried it forward,
Yeah.
but we don't have a report. I don't think you can pull out anything that says.
Not really.
Otherwise, I could have just let them turn into undesignated fund balance and we'd have to budget it again for money for the library. I mean,
Right.
that was
You're-
again.
You're recording this event, so we are reporting on it, so I think we're okay.
Any more questions on capital reserves? Or are we ready to move on to debt service? Hearing no objections, moving on to debt service, 51. Yeah,
Very little.
yeah, it's just one page. All right, debt service going, this is the broadband 51.4. The amount that we request doesn't really change, just more gets allotted to principal and less gets allotted to interest as we go on. So that amount hasn't really changed. 51.5 is the municipal building project. Same thing. We're just very interest heavy in that because we're only 2 years into it. And then just contingent funds, asking again for 30,000 really kind of covers any one-off expenses that really don't fit into something else. That's what we use that for. That's just so, same ask as last year, asking for another 30,000. We haven't used that full amount in the past. It is nice to have it just in case we need it. For example, this year, fiscal year 26, so far we're at 2/3 of that balance spent. So, it does get used.
Yeah.
Any questions on debt servicing? All right, next is broadband.
Yes,
And we do have Janet passed out this memo from Barry.
Another white piece of paper.
and I'm representing the broadband group on this. It's a 30-second, but
Yep, not a whole lot of change. You go ahead and you take it away, Steve.
yeah, no, the broadband committee kept it flat. There's a increase from CMP for the pole usage that we couldn't, we had to absorb. We had 15 additional participants on it, which actually increased the cost at a minor amount, but it was really just the CMP increase that affected it by about 10 grand, but there's no increase in our request other than what was forced on the broadband. So
Any questions? Hearing none, should we move on to revenue?
Revenue it is.
Do I have that?
I thought I saw it in there. Is it in the town budget pages or is it?
It should, oh, well,
No, I have it. I'm making sure Carrie's got it, you know.
well, it's a separate file.
I'll have to open it up. Sorry.
Did we find that one file that had everything in it?
Mhm. I hadn't opened it. Is it the worksheet?
Give it a try.
This one?
Chapter 1, 3, 2.
Keep going. Oh, maybe go scroll up. I think you might have been at the end of it. Yeah, there it is.
That's the health center.
Okay, well, I will share this then.
Go ahead and go all the way to the top where the health center is. Excellent. Revenues, now we're all looking at the same thing, starting with the health center. Patient charges, we're anticipating 300,000, fiscal year 25, we ended up at 318. This year so far, we're at 142. We are actually lagging a little bit from last year. That doesn't necessarily mean we're gonna finish below our expectations. So we're still expecting another 300,000 there. Now, of course, Chris did just mention that, Dr. Wright just got credentialed through Medicare, Medicaid. And, so that actually should increase that number a little bit. The endowment, we're grabbing another 63,000 out of there.
What Janet just gave me, there's 1.8 million in the endowment.
Correct.
And the 63,000 represents only about 3.5%. Is that
The amount
That's
that we're
all-
allowed to
That's
take.
all we're allowed.
who's
Maine
allowing?
Community Foundation.
Maybe we'll put it somewhere.
Well, I mean, it's an endowment. It's held as an endowment
Right.
that we
And then
actually
you're
can't
not
touch.
projecting any increase in the purpose.
In the endowment?
Yeah, I mean,
Well, maybe. some
people
rules.
fundraising.
No one has taken it on. There's been so much other fundraising going on the last few years.
Right.
And that is mostly funded from a couple of individuals and a home that was donated to the town. And
No,
that's how it got.
because it seems like we've expanded the health center immensely. We've added to the staff and the beneficiaries are the community, which includes the seasonal population
Would you
and,
like to take that on?
yeah.
But also, if you know somebody that wants to donate to the endowment, I'll be glad to accept their donations.
Well, I'm not volunteering, because I volunteered for too much, but it seems like
That's what it would.
that is something that,
Yeah, I mean,
Good
Sue
thing.
Schnur started this
I mean,
way back.
you know, the Penn Bay facility has endless buildings and facilities that were all been donated by charitable contributions.
I hope someone would say they
It all
wanted,
takes a champion.
yeah, I hope someone would name the health fund, you know, it would give a big donation, then
Right.
I'll send a name after them, you know, put a name on the wall. I don't-
Okay.
All right.
All right, going on to broadband.
Could be the new Conover wing, but anyway, go ahead.
Oh, yeah. Got your checkbook, right?
All right, going on to broadband revenues, 60-101. Expecting 276,140.50 this year, up slightly. Now comparing that to, oh, that's just kind of what we've already brought in so far. And comparing that to fiscal year 25 actual, we may end up bringing in slightly more than anticipated there, which is great because that service costs about twice what we bring in for it.
People keep signing up for it too. I mean, it's
Fingers
ongoing.
crossed.
You keep thinking, there can't be anybody else.
Well, and every time somebody doesn't pay, then they get charged an extra $50 for the same service. I mean,
I think right now it's down to about 10 that are outstanding.
oh, that's good.
Good
Yeah, we
job.
had 15 new subscribers this year so far.
Okay,
Yeah,
excellent.
just this.
All right, and then other revenue for broadband would just be the town subsidy that makes up the rest of their budget. That's it for broadband. Any questions on broadband revenues? Hearing no questions. Moving on to Department 41, General Government. General Government, 41,200. No anticipated changes there. I don't know why fiscal year 25 was so high there.
I think, a lot of that might have been some, not necessarily COVID money, but some grant money that went in there, but then it got
Maybe, okay.
transferred.
41.
FEMA money,
Gotcha.
it's kind of like general government is like a holding place, if we don't know where to put something, I want to get that check in the bank.
Yeah.
And then we talk about where it should go or just it gets moved.
41,201 copier reimbursement. We have less takers on that, so we're expecting less revenue for copier reimbursement. Same with fax reimbursement. Fax reimbursement stays the same from last year. Planning board fees, we're expecting that revenue to remain the same, as well as plumbing permits. Dog agent fees are staying the same, hunting agent fees are staying the same, town clerk fees are staying the same. The state park subsidy, we're expecting, we received a little more this year, so we're raising our expectations for next year. Snack Shack, are we expecting a rise in revenue there?
There was an additional $100.
Okay.
That was charged for broadband down there, so.
Okay, so we brought that up a little bit.
Sorry, is the planning board fees to start building permits?
Mhm.
Yeah,
And how do we come up with that figure?
the 3,000,
Yes.
based on previous years, fiscal year 25, we did right just over 3,000, 3,071.
I see.
So we're basing our expectations on what we've done in the past, at least for revenues.
Seeming like the cost of construction on the island has skyrocketed.
And we don't benefit from it.
We should.
Well, then someone needs to raise the rates.
And are those rates currently in an ordinance? Would it require an ordinance change?
In the ordinance. So much a square foot per house.
I think,
so much-
I think a couple of years ago, didn't we change it so that it was, at the discretion of the select board?
Possible.
I thought we did too.
I thought it was just for, waste removal. Maybe we did it across the board. But, cause I know when we changed the fee rate at the transfer station. I know we did it for then, but I don't know if we were able to do it across everything.
Cause it seems to be, it should be a graduated step.
Is it 10 cents a square foot for houses?
I don't know. I'm sorry. That's a number I don't keep in my head.
Dave question, proceed.
I guess, is that a question that you could find out for our next meeting?
Yeah.
Just what is required to revisit those fees?
All right,
There are some construction projects on this island in the 8 or 9 digit department. If they're only paying 10 cents a square foot, that doesn't sound right.
And garages are, I think, 5 cents a square foot.
I mean, yeah, those fees can absolutely be revisited. Yeah.
And there's a flat fee for, that Dave can approve, I think that's $30 if you're gonna build a little deck or a little shed.
Right. I think if it's underneath the planning
10 by
board,
12.
yeah,
Well, you don't need a permit. 10 by 11.
All right, moving
all
right
right,
on.
moving on to 41,404 tax exemption reimbursements, we're still hoping for 1,000.
Mhm.
Money market interest, I expect to go down because rates have gone down, but we're still making significantly more than we were expecting just a couple of years ago.
That's pathetic.
And then, interest on taxes, we're kind of expecting that to stay the same as well, although we've got a lot of people that are late on the property taxes this year, so that figure might increase.
Just because it's here, do we know how much is currently in our fund balance?
Undesignated fund balance?
Yes.
No,
Can we find that out before our next meeting too?
I will see if she
I
can.
ask. I
I
think,
mean, we need our best estimate.
Yeah,
We're at that point.
I know she started on fiscal year 25, so she might have an idea.
Cause I think she tried to say something about the last year, previous year, what it was, and then
Yeah.
trying to think about, I didn't think that was gonna be.
It's one of those things when we put it in here, it's an estimation because we don't actually know what the undesignated fund balance is until
Right.
the audit has been done.
Yeah.
Ask her. So yeah, we're guessing initially, but yeah, we can.
Yeah, no, but it's the point where we are at, we need to ask for her educated guess here so that we can.
All right, going on in revenues, Department 43, Public Safety. Expecting an increase in both fines and sticker sales, only because we've already increased what we've done so far this fiscal year.
Like Carrie's doing.
It is all Carrie's doing. She's the only one that keeps this place together. Moving on to Department 44, Health and Welfare. Ambulance fees, we actually expect that to go down.
We're not doing so well.
Well, and MRS has trouble recovering some of those trips from insurance and things like that, so we're kind of reducing our expectations. 45, Public Works, auto excise, we're still keeping it 175. I would love it if we continue to do 260,000 a year.
Buy some new cars.
Yeah, everybody on the select board needs to buy a new car.
Expensive car.
I was shocked. Because I'm used to like 20-year-old vehicles
Yeah.
costing nothing.
Yeah, in 6 years, you'll get the lower price.
If I'm still alive.
Bottles we've gotten rid of, those are being given to the junior class. They're just, Jeff collects them, keeps them in a pile, and the junior class comes by once or twice a week to collect them, so we're not expecting anything from bottles anymore. That also means that Jeff is not traveling off the island to do bottle redemption, so we're saving on ferry fares and his time and everything else. Hangar fees, expecting to increase slightly.
And we have received one payment, I think, just this week for $775, an overdue one, so.
I think 775.
I think it was, that's the lease.
Gotcha.
Yeah.
Lastly, local road assistance, LRAP, we are crossing our fingers to receive 45,000 in the future. But it did go up from 25 and 26, so we're hoping it continues to go up. Going on to Department 46, waste removal. No change in the expectation for selling trash bags. No change this year, at least, in the expectation for demo and appliance, although based on the previous actuals and this year date, that might be able to go up a little bit. No change in the expectation on metal. And a slight reduction in the expectation for electronics.
Oh, he's still collecting the bottles. What is he doing?
They're in a pile.
The
And they're
school picks them up.
And the school comes and picks them up.
fabulous.
Junior
So
class.
next time you go up there, right next to the what they call it, the exchange shack, or whatever it's called,
Yeah.
swap shop.
Exchange.
Yeah, I had the words
I
right.
know, I noticed.
But anyway, yeah, the swap shop, next to the swap shop
Right.
is the pile of bags, and that's where they're being collected right now. Department 47 rec. No expected change in boat fees, no expected change in dinghy, winch fees, clam licenses. The only change here is, Adventure Camp is expected to increase its utilization, as well as, the rec department was looking to do, some additional races, which are good for, bringing in money for recreation. So they have increased their revenue expectations, by about 14,000, so it's great.
I have a question. If the harbor committee implements the mooring fee, where will that be? Not in this year?
It won't be in this.
Mhm.
Okay,
Nope.
got it.
Now, if they implement it for fiscal year 27, but we don't have a place for it, it's something that we'll make. And we can take the money in, it just is not included in this budget, basically.
This might be.
However, creating revenue where none existed before is not a bad thing. Department 49 unclassified insurance rebates, been pretty consistent, but we're still expecting about the same thing, 2,500. Homestead exemptions, we raised that a little bit just based on the actual this year. So we're raising our expectation to 40.
What is that?
Homestead exemption?
Yeah.
If someone claims a homestead exemption on their property taxes, the state actually gives us that money back.
I think.
So it reduces their taxes and then we claim it from the state. So, yeah, if you have a homestead exemption, it does not hurt the town.
No, and it's the assessor is in charge of that, the number of records and reports, so.
And then municipal revenue sharing is also money that just comes from the state. And we are reducing that expectation a little bit just because of the money that has been coming in has been lower.
Cause that's what they said.
Than in previous, well, yeah, they told us it would be lower but so we're reducing that expectation, so. That was revenues. Any question on revenues?
If we do successfully, develop this very road parking plan that would increase permitting license.
Correct.
For
Yep.
fee,
Yes.
Yeah, so.
I'm only a year into this.
I like it.
That's everything we were going over tonight. Does anybody have any questions on any of it?
Do you have an idea of what the net is now?
You know what? I didn't calculate that.
No.
We still,
Well, even just, let's start with town, what we can control.
I'm gonna work
You know,
on my
but-
summary, which will help.
Yeah.
But,
we still don't know what the plowing expense is gonna be.
Yeah. We'll know that next
we do now know the health center expense, or at least what they're asking for. I mean, we can guesstimate based on what we do know and kind of give you a caveat of like, look, this is what we used for the
Yeah.
plow contract. If it goes up, it goes up. If it goes down, great. Then
and we'll know the school next week, right?
But yeah,
Monday.
Their budget.
but yeah, that's
I'll have
the.
to get out.
That's a figure we can have for you, for the next week.
Yeah, I mean, I think it'd be helpful to have it all, if you could send out the full spreadsheet so that we could look at it and, I mean, if next week we're doing, I know the budget review. I just wanna make sure that we have time to actually understand what the total impact is and discuss how much we may need to think about saving, and I worry if we just get a spreadsheet, right ahead of the meeting, that we're not gonna be able to have a thoughtful conversation about that. I mean, we'll have another meeting to discuss it, but.
So then Janet and I can work on, completing the spreadsheet as much as we are able to do. We'll plug in a number for the plow contract and we'll just let you know what that is
Yeah.
and say, hey, we're estimating based on this number.
Yeah.
Everything else we basically know though, so.
And you'll put 15,000 in for the housing
Housing.
And 50 for Peter's Berry Road thing.
I just.
I just want it bookmarked in there.
I will, Sharon, I'll call you if I hear something back from Bill.
Yeah.
Because he's supposed to do an ask.
Putting that in.
Maybe it's just gonna be dirt this year and next year it'll get paid.
Well,
And
exactly.
that might be what we have to
You
do.
know, we agreed with DOT to do all this,
Mhm.
that was expensive, they want a curb along the road.
Right,
But I don't think anybody is gonna say, come back and say, did you actually do this year? So I think the 50,000 is probably tentatively a safe number.
Okay, and that could
In
come out
the
of
budget.
something we've already budgeted for, okay, even, we already.
I just don't want to take away from the rest of the roads, cause they're getting so bad.
Right.
Well,
Uh,
spring too.
Unless the.
Steve,
town
when you're
authorized,
coming
like,
back from
30
your-
million.
There's a
Can't we
frost
make the
heave in front of your
entire-
house.
Oh.
There's a
terrible.
what in front of a frost
big-
heave?
Frost heave
Heave.
in front of your house.
I don't allow those. How did that happen?
You better go talk to it.
It popped up in the last couple of days, but it is ferocious.
Wow, you're
It is
in
awful.
San Diego.
It popped.
So when we
Oh,
were
really?
I can get my notes.
Yeah.
I had that thought too, because I had not flown, I drove at a prudent and reasonable speed. And as a prudent and reasonable speed, going past Steve's house, it went, boom, and I was in the next lane and I was like, shit.
Real quick, before we wrap up, may the Lord have mercy on my soul for suggesting this, but some, next week's. Is it realistic that we're gonna be able to get through our review of everything and review the school budget between 5 and 6 p.m.?
That's why Janet and I are gonna get the spreadsheet out to you guys before the
Yeah,
actual
and you
meeting.
can push back the selectmen's meeting.
Well, that's what I was thinking,
Yeah.
like, I don't know, maybe if we,
Yeah.
I don't know if we might
The
be smart to
select-
just buy ourselves an extra.
Yeah, what are the
10 minutes
selectmen
buffer at the
meeting?
end. I don't wanna start us any earlier, I don't wanna signal any longer than they have to, but I'm just worried, these are both conversations that I don't want us to have like. Cut off all of a sudden. And it might be wise just to.
So what time do you want us
Could we
to have
publicize that the select board meetings start time, like, could we even, I don't know if it's possible. By 6:30, is it open, so we put out some sort of slightly open-ended timing?
What else?
Cause that way, like, if we wrap up at 6:01, we could start at 6:05 and just keep rolling.
Yeah, but we could just say following the budget.
Yeah.
workshop.
Yes. What is on the,
There'll be
so
several big
Can-
openings.
Can we do that?
what is on the agenda?
Oh,
So right now,
It's our whole review.
Review.
No,
and
no.
the school.
Right, the select board.
Oh,
Okay.
good, oh.
but in the select board meeting.
But I also want to be clear, the school, I mean, Zach will be here to answer questions, but I think they're having their public workshop
Monday.
right between now and then, so my expectation isn't that they're going through another detailed review of
Yeah.
of their budget, that it's a high level.
They canceled their additional meeting yesterday. They didn't even meet. The budget that they're putting forth is the one that they're wanting to go and sort on. For lack, I'm sorry, that's a,
No, it's not, it's
Oh,
fine.
wait,
It's good,
but I'm
it's good,
sorry.
But so, okay, so then, okay,
Is anybody interested in information on buying your own snowplows?
sure.
yes.
There you go.
Yeah, if you've got it, I'll happily take it.
Is there a meeting after this now?
Yes.
Because I have,
That's with them.
then I will not be able to attend. I
Steve,
didn't
it's
know.
mandatory. It's training. Yes,
Mandatory.
mandatory training for Steve.
All right,
So can I
goodbye.
just to understand this, well, she just handed out some information that I just want to ask some questions about. You'll send this to,
I'll send it to Steve.
okay, so
I
there's
thought
the
he was
four-
gonna be here.
right, there's the 4 trucks and then there is the $300,000 underneath of that is,
That's for 2 additional trucks, small ones. The 2 up at the top are 2024s. And, the dealer there, so he told Josh about those, but if you wanted all brand new trucks, they'd have to be ordered, but.
so that would be swapping the 267 for the
Yeah,
300.
And if you
That's-
decide how many trucks you want, you want one big one, you want no big ones, you want
Well, I would say,
a truck,
It-
no
but-
CPO?
based
Well,
on
we
what our
want-
bid required, is the top 4.
Yeah, but if you did it yourself, you could buy whatever trucks that you wanted.
Good to know.
So you
But
still have
so for me,
operating.
Is that?
Change.
Okay,
It's up to Normie from.
okay, great. Well, then, is there any further questions that people want to discuss as part of the budget tonight? All right, budget workshop is over.
Second.
7 o'clock.
Thank you.